Good afternoon, everyone. Thank you for your interest in Dr. Sacra's well-being. Rick has been a faculty member in our Department of Family Medicine and Community Health now at UMass for 22 years. He was a graduate of the medical school, and he specifically actually trained at a residency program down in Tennessee to learn several procedural skills that would be important for him to pursue his interest in serving as a missionary family physician abroad. He's been associated with SIM and the Elwa Hospital for over 20 years now in Liberia and has spent the majority of his professional career there. We've had the good fortune, and I had the good fortune of hiring Rick in 1992, fresh out of residency, while I was medical director at the Family Health Center of Worcester. And that has been his second professional home. Here at the medical school, students and residents have had the great fortune to work with Rick and to get to know him. He is the consummate family physician. Not only is he incredibly bright, incredibly skilled with his hands, able to perform a number of surgical procedures, but is also just a wonderful human being who's committed not only to his passion around missionary work, but also in his spiritual life is incredibly devoted to combining spirituality with medicine. So with that, I'll take some questions. Well, of course, it came as a shock to hear that Rick was sick. I learned of this yesterday, and while I was seeing patients at Family Health Center of Worcester, and you know, at the same time, I think that we're seeing better outcomes for individuals who are in good health, as Rick was, and hopefully, I think we all have a lot of faith and a lot of hope that Rick will come out of this and recover.
From what we've heard already today, it doesn't sound like he's the type of person that would have backed away from the situation even though it's dangerous.
Say that one more time, please.
It doesn't sound like he's the type of person who would have backed away from the situation even though it was very dangerous.
No, he's been emailing us with some stories about his clinical work since returning to Liberia approximately a month ago, and has had some incredibly poignant clinical experiences. He's been shouldering a lot of the work of taking care of women who are pregnant and taking care of them during labor and delivery. Liberia is a very rural country. Sometimes women travel for hours or days to get to the hospital in Monrovia, and Elwa is a wonderful place. They will accept people and welcome them in and provide whatever care they can.
My understanding is that he went back to Liberia, went back a little early because of the two doctors other doctors were pregnant.
That's.
I
don't know any more information about that personally. Perhaps Ginny does. I only know what I read in the press release today from SIM, that clearly he reached out to them at the time that his colleagues took ill, and was ready, willing, and able to return and provide care. And it speaks to his profound dedication for the people of Liberia. I also want to just briefly mention that this is not just an issue for our community, professional community, but the Worcester County here in Massachusetts has 10,000 Liberians and Ghanaians living in Worcester County, and obviously we're concerned for their family and loved ones as well. This is a crisis that extends to our entire community. We have a global health track in our family medicine residency program, and Rick, when he's here in Worcester, has participated in some of the teaching for residents in training and medical students in training around his own and personal experiences in serving a global community, and I think the students and residents have greatly benefited from that. What is particularly special about Rick is he is not only a gifted physician, he's truly an incredibly patient-centered physician who has just impeccable communication skills and is very unassuming and humble.
Great. Jenny? Thank you, Dr. Ferguson. Thank you, Dr. Ferguson. For those of you on the call, we'll now hear from Dr. Jenny Van Duyne.
Hi, I'm Jenny Van Duyne. I know Rick from, actually, since I was a kid. I used to babysit his oldest son when he was a toddler. Now he's in college. So I've known his family for a long time. Throughout my kind of course in pursuing a career in medicine, he's been a mentor to me. He's been influential in the kind of doctor that I am today. I got to spend a few months with him while I was in medical school, working in ELWA Hospital outside of Monrovia in Painesville, Liberia, where he is right now. I had an amazing experience there. He has incredible skills as a physician, his physical exam skills. To get to your point, he is really excellent at the bedside with patients. He meets them where they're at. He shows them love no matter what stage they're at in accepting their disease or in accepting what they need to do to change. He works with them. One example I can think of is this example of a patient with diabetes who he was trying to explain the diabetes to, and he speaks Liberian English perfectly, and he used this example of the sack of rice that they have in the cupboard, and used that as an example to explain what they needed to do with their diet and how to treat their diabetes. So I had the privilege of working with him in Liberia as a resident, and then, as a medical student, and then back here at UMass as a resident. I was under his mentorship. He definitely brought his physical exam skills, his bedside manner, his expertise, his eye for the unusual and figuring out exactly what a diagnosis is. And the residents and medical students here have benefited greatly from him. And now, as a colleague, I've been able to work alongside him as faculty, delivering babies and taking care of patients at Family Health Center. Rick has a heart for Liberia. He, for most of his medical career, he's spent time in Liberia, whether it be for, full-time staying there or coming back and forth, as he's been doing for the past year. He even stayed during one of the horrible times of the civil wars where he evacuated his family but stayed behind to make sure that the people had the care that they needed. Recently, as we were saying goodbye to our graduating residents from Family Health Center, I was talking to him about the crisis of Ebola going on in Liberia and West Africa, and he shared with me his suffering about how the people there suffer so much already, and how they're suffering even more now under this crisis, and how he hopes that the message. Even then, he was trying to get more people to be involved and send more resources and get the message out that there are things that we can do. He really believes that one person can make a difference, and he's shown that in the way that he's living his life. So I think that's the message that I would like to convey today about Rick, is that, he wouldn't want me to call him a hero, so I'm not calling you a hero, Rick, but even if we don't go to Liberia like he does, then there are things we can do. We can pray. We can donate to organizations who are on the front lines there, like SIM, Serving in Mission, the organization he's with. There's Doctors Without Borders, and there's a Samaritan's Purse. They're all there in Liberia, and I'm sure there are other organizations on the ground in West Africa working right now. Also, I would say that we could advocate in our own community by calling and emailing our politicians to advocate for more resources to be sent. This is the message I think that's most important, is that, yes, Rick is affected, and he's affected greatly by this disease, but so are many, many people, and many people he's been devoting his life to. Thank you. I can take questions.
Do you think his personal touch puts him more at risk?
His personal touch. That's an interesting question. I know Rick takes every precaution. He's very careful, and while it may seem cavalier for him to have gone to Liberia at such a time as this, he did not do it lightly. He spent, I'm sure, a lot of time considering what it would mean for himself and for his family and for his community. But the mission is really strong for him.
What do you think it says about him that he, when his two colleagues fell ill with Ebola, he rushed back early over there, rushed really putting himself in harm's way?
Mm-hmm. What does it say about him? I think he's courageous. I think we as doctors have a privilege of being able to care for other people in their greatest time of need. That's not something that just anybody can do. So that's, with that privilege comes great responsibility, and I think he really takes that seriously.
Can I ask how you first, you said you're known him for a long time. When you got this news, I guess, how did that hit you, and how are you feeling at your heart right now?
Yeah, I'm scared. I'm sad, but I also know that I'm trusting that that he's in good care, that the people that he's been mentoring in Liberia are caring for him, and what an amazing message that sends. And I'm hopeful.
If I could just interrupt, I believe that Felice Fryer from the Boston Globe, are you on the phone?
Yes.
Okay, so feel free to ask your question, Felice.
Yes, sir. Dr. Van Duyne, you mentioned that you were talking about him being a mentor for you. Could you tell me a little more? Did you go into medicine specifically because you knew him?
I can't say that he's the sole reason I went into medicine, but I did grow up looking up to him in a big way, that he was doing what I always thought was important to do. I had experience early on actually in Haiti in high school, and I met a doctor there, family doctor there, who was really the instigator for me thinking about medicine. And then on a more daily basis, I got to see Rick doing it, and that certainly spurred me on. All along the way, he's also been mentoring me in there are lots of bumps in the road in becoming a doctor. It's not an easy thing. So yeah, he's been a great role model for me.
In this recent email, did you say anything you could share with us about the conditions there, what the Ebola outbreak had done to, I guess, the medical system there and everybody? It sounds like it's pretty chaotic.
Yeah, he described it as being very similar to when he was there during the war. He hadn't seen it that bad since the war, which means it really uncovered the poor infrastructure that the health system has, that there are very few providers who are able to give the care. There are very few resources to begin with, and then when those resources and people were stretched, then they couldn't meet the need. So it's been really bad.
In one email, he shared the term. In one email, he used the analogy to a forest fire and described the outbreak as burning out of control. I think that there's a lot of concern that there are insufficient resources right now coming to bear for this epidemic. And if there's one message we could leave to people, it is for policymakers to step up to the plate. This is controllable. More funds are needed for private donations, and we really need people to step up to the plate for our neighbors.
Excuse me, when and how did you hear the horrible news?
I've been emailing with Rick up until last week. Then I hadn't really heard from him. I've been in touch with his family as well, and a family friend had heard the news from the family and passed it along to me on the phone yesterday.
He seems like an incredible, given, and very spiritual man. Have we heard anything about his spirits about this situation?
Yeah, it's so typical Rick that he's in good spirits. He's surrounded by people that he loves, and he's in the place that he loves.
Are there any further questions in the room? Okay, excuse me just one second, Jenny. I know that many of you are on a tight deadline, so we can wrap it up here. I just want to make sure that everybody who's joining us on the phone has had a chance to ask any questions that they might have.
I know I can share this. It was in the SIM press release this morning that he's being cared for at ELWA Hospital, where he has been working, that he's in the Ebola isolation unit, that he is being cared for by the people that he has mentored and taught or cared for patients alongside for years, and he's in good hands.